Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I'm your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. It's really great to be with you today. Today's topic is about the workforce situation across our country. I want to talk about workforce crisis to access revolution. That's kind of my whole theme here. This conversation, I'm hoping, will address the critical workforce challenges in the field of dental hygiene that we're having and really present kind of my vision for transforming access to care through collaboration and innovation with policymakers, with dentists, with DSOs, private practice dentists, educators, and dental hygiene students. It's going to take all of us to really think about how are we going to move forward. So first, let's talk about the workforce crisis. There are current shortages of dental hygienists across the United States, and this definitely directly limits patients' access to essential oral health services. We know that. Now, whether you're talking about access to providers by accessing a DSO or a private practice dental provider or a community health center, if the shortage truly exists, then there's going to be pent-up demand for preventive care across all sectors of the population. Now, we know that routine prevention is the key to long-term success when we're talking about overall health of a specific population. Now, access to providers who can perform those preventive services is a key element to successfully really reaching this shortage issue. So I would like to shift our focus from the brick and mortar of the past, right? You had a hygienist, they worked in a private practice office, patients come to see those providers, the dental hygienist provides those therapies, and the patient leaves. How many of those patients have so many barriers stacked up between them and that access? So I want us to think about whether or not it is that we have a workforce issue or if we have not pivoted for today's population. So the impact on our care quality, think about longer waiting times, reduced access to preventive care, and then we can't help but talk about the increase in oral health disparities, especially in those underserved communities. As dental health providers, we are naturally advocates for recognizing that there's a workforce crisis as a public health emergency. We understand and value the need for preventive services, so we really need to take immediate attention and dedicate our energy into figuring out what resources we need to align with so that we can really focus on access. So if our focus is access, then the attention should be on providing those preventive services to as many members of the population as possible, meeting the patients where they are. Now, this would shift our current brick and mortar model of patients accessing preventive dental services at a dental office to getting out into the community, right? Getting a hygienist to the schools, getting a hygienist to the nursing homes, getting a hygienist to the hospitals, having a hygienist in with those primary care providers. We know that if we can get the preventive services to the people in the areas that they are already accessing, we can reduce the cost to provide those services. And at the same time, we can break down the barriers that exist in accessing that care in the first place. I mean, a great example of this is the preventive services that we currently do in some of our public school systems for children, right? Preventive and adjunctive services to elderly citizens in the nursing homes. These people, they're highly vulnerable and they have limited ability to access providers who we know these patients are at the highest risk because they have comorbidities, and those things impact their systemic wellness as well as their ability to manage disease. So we know the impact that quality oral health preventive services can have for these populations. So let's talk about what the root cause of these systemic issues are. And I can't talk about this without talking about education, right? So the educational pipeline constraints, such as limited program capacity, right? I might have in our program 150 qualified applicants, but we have a max capacity uh, of how many students we can fit into our facility, how many faculty, qualified faculty we have, and then the inability for us to really expand evenly and equitably in a way that new hygienists can enter the workforce at the demand that's there. There is pressure in my state to increase the number of students who graduate each year from our program. Now, the cost to run a dental hygiene program is substantial. The facility capacity are costly to maintain, and the state laws require us to have a dentist on site for supervision without necessarily having a responsibility of a teaching load. And this further expands budget issues at the educational level. Now, addressing workforce retention challenges is another, cause of the systemic issues. So burnout, job dissatisfaction, lack of career advancement opportunities, these things lead to high turnover, so graduation for students is not a guarantee of long-term career satisfaction. And for many students, the pressures of high production, treatment planning that maybe goes against their education, selling dentistry, and working on a treadmill feeling, that provides a really quick road to dissatisfaction and lack of purpose. So that's just another cost of the systemic issues. Policy barriers that limit our scope of practice, delay licensure, and restrict innovation of care delivery models. So we know that the scope of knowledge that's passed down through the compendium and the CODA accreditation standards really provide our students with a high level of knowledge. And then they get out into the field and they feel the limitations of that scope of practice, setting in motion that feeling of scaling being the focus, right? Students will quickly get lost in the system and find themselves trapped without that feeling of being a difference maker in the lives of their patients. So important life-saving screenings like oral cancer and blood pressure, those things are quickly lost due to schedule constraints. And there has to be an emphasis on the need for systemic reforms in order to remove the barriers and support sustainable workforce growth. Autonomy and self-reliance to be a difference maker in the profession, I believe that's an essential piece of long-term career satisfaction. When that dental hygienist feels like they are impacting the population health, caring for others, making a difference, and saving lives, they remain committed to the field. They remain engaged in the profession. Let's talk about an access revolution from my perspective. So, increasing educational program funding to grow enrollment and improve resources, that's a piece because we are not keeping pace with the workforce needs. Adopting some flexible training models like accelerated programs, part-time options for working students and parents who want to enter the field, competency-based education that accommodates diverse learners, right? The current model is strictly time-based education. If a student doesn't achieve a competency by a specific time, the end of the semester, basically, they are no longer able to move forward. And there's no alternative plan for that student in the current curriculum structure. We need to leverage technology for remote supervision and telehealth for our providers that extend that clinical training capacity and really enable care delivery systems to be utilized in these underserved areas. The dental hygienist has that capacity to engage with patients in this capacity. This is what we're designed for. This is what we're trained to do. But the reality is the laws and restrictions, they limit the access for patients' needs. This entire thing needs a complete overhaul. I have to say, my vision for an access revolution would also include encouraging partnerships between the educational institutions and the practice settings in order to create more clinical training sites. Partnerships between the dental providers in the state In the schools, that is essential if we want to meet this shortage issue and create lasting change for the profession, the patients, and the providers. We have to support faculty development and recruitment to address educator shortages. Now, we don't have an educator shortage in my state. We have an ample pool of qualified educators, but there are states that have educator shortages, and educators are feeling the stress and strain and the pressure that has been put on them as a result of this workforce focus. So I have to bring that up. We should focus on promoting policy reforms that enable expanded scope of practice and innovative workforce models. Now, in my state, the Certified Public Health Dental Hygienist, it has the original rules that were set forth in the development of this credential more than 25 years ago, with absolutely no change or revisiting that scope of practice model to see if they got it right, or if there's a need for an improvement, or maybe a relaxation or change of some of those restrictions that were very conservatively placed because they weren't sure how that model was going to roll out. We need to revisit these things and say, okay, so we had these restrictions and we saw that nothing bad happened. Let's look at that model again to see if we can update it. We need to constantly be thinking about ways that we can be innovative, team-based care, expanded scope, community-based preventive programs. All of these are the focus area. It should not be a focus on workforce shortages or reducing the standards, reducing the education to meet the needs of the patients. It's about access. This is an access issue. We need to stress the importance of empathy and urgency in addressing these oral health inequities, calling for collaboration among all of the providers together. Now, if I'm talking to you and you're a DSO, I'd like you to advocate for operational strategies like workforce development plans, partnerships with educational institutions, investment in your employee well-being to improve recruitment and retention. If I'm talking to you and you're an educator, I want to encourage curriculum adaptation to include emerging practice models, interprofessional education, enhancing student support services to prepare graduates for the evolving roles. Partnerships between dental schools and dental hygiene schools that build collaboration between these providers to better serve the patients in a comprehensive way. Educational standards save lives. Some of the current legislation in some states are actually turning away from these educational standards in the name of workforce. I question the long-term effects of these initiatives. And if I am talking to you and you are a student, I want to inspire and empower you by highlighting the diverse career pathways that you can pay for yourself. You have been provided a clear pathway to public health. You are shown these models that lead you into private practice. There are leadership opportunities for you if you have a passion to develop a program or to work outside the operatory. And the significant critical role that you play in expanding access to care cannot be denied. Students, see what's possible. I want you to see what you can do. If we as educators show you that you are capable of following your heart into the service of the public, then I know that you can do just that. My call to action for all of you is to urge all the stakeholders to collaborate on workforce solutions, including policy advocacy for scope expansion and funding, to promote community engagement initiatives that raise awareness about oral health access issues. Focus is currently on workforce. The real conversation should be on access to care. Access improvements will change the outcomes, not the workforce. I want you to commit to measurable impacts through tracking workforce metrics and patient outcomes. Ask yourself, what percentage of the population is not able to be seen in this traditional model that we have engulfed over 100 years? Who is speaking up for those people that don't have access? How will graduating more dental hygienists actually improve access to care for those people without changing the scope of practice for the providers? What we have done has never worked for all people. Preventive services are inexpensive, they're sustainable, and they should be easily accessible to all without barriers. If we bring the prevention to the public and utilize the dental professional specialists at the highest level of their scope of knowledge, we could have an access revolution and change the landscape of oral health forever. I did go to Washington, D.C. in October, and I stood there with other dental hygienists to rally, to share with the public that educational standards save lives, that dental hygienists matter, that we are an integral part of the dental team, and that we are the key to improving the overall health and well-being of the citizens. We just need to look at how the model needs to change in order to make it happen. I hope you guys have a great week. I hope that I've stirred something up in you to think a little differently about where we're going, where we need to go, and how we need to get there. I am very positive about our future, our profession, and our profession as providers. We are healthcare providers, we are professionals, and we know that together, with the collaboration of dentists, DSOs, and private practices alike, with all of the stakeholders that come to the table, that we can create models that work for all citizens. You guys have a great week.